Many people view children just as a little miniature adult, and we don't look at them like that at all. We look at them very individually and really have a very special way of taking care of kids.
Ooh, it's fast.
We serve pediatric patients here in all three emergency departments, and they're a special population and they need specialized care and treatment. Some of the ways that we do that is, first of all, is in our approach of the child and how we speak to them. If they're a 2-year-old versus an adolescent, you're going to treat them very, very different. We have a lot of methods to help with younger children and even some of the older children for getting peripheral IV starts. Most kids come into any medical environment fearing the needle, and if we can provide a measure or a means so that they have a positive experience with that, then that puts the child at ease.
High five?
We have distraction boxes in each of the EDs. They have bubbles in them, squishy balls. We also have prizes like stickers and things like that for when they finish the procedure. We have something in the ER we call the blanket project. We're always trying to get blankets, colorful, soft, fuzzy blankets that the children can take home with them. And so suddenly the environment sort of switches just a little bit and takes that clinical just a little bit out, just so then the child then kind of comes a little bit more at ease. It helps to get a better clinical picture of the child and ultimately provide better care.
She has Dravet syndrome. We first found out in January of last year. A few times a month she has very prolonged seizures. Last summer she was having smaller seizures throughout the day. She was having around 30 plus a day.
I'd say probably 2 to 3 times a month we're in the ER. Last year there was a few that stopped on their own, but majority of them just keep going until they get to the ER.
We have many children who frequently visit the ER who have chronic conditions, and we have a relationship, a very close relationship with those families.
They're always, doing whatever they can to make her comfortable, get her blankets, you want juice. She's always asking for purple popsicles in there. Everybody's just super friendly.
Yeah, very friendly.
Tries to take care of her and us and make sure, we have everything that we need. Natalie has really facilitated educating the staff over there with her disorder and the best plan of action and how to manage her situation.
Prior to the child even arriving, we are ready and they are standing so that there's no delay in care, and that's so important, especially with the children who have chronic conditions that they need their treatments very, very expeditiously. We work hand in hand with the Children's National Pediatric Hospitalists. Having the pediatric hospitalist partnering with the ED really coordinates the care. It takes that initial care that we started in the ED and then marries it together with what is going to happen in-house and when they get admitted.
We're all hired by Children's National, and most of us spend some clinical time there as well. Our experience at Children's National makes us a little bit more prepared to deal with anything and everything that we see. We cover 24/7 on the pediatric unit, so we're in-house all the time and available for any questions or issues that might come up.
We have the wealth of expertise of everything that they bring to us from Children's National. We incorporate their policies into our care. We use their protocols. And it's just very important as a parent that you have that confidence that there's somebody right here, not just here, but really knowledgeable and an expert. A lot of the approach of taking care of the child from an emotional aspect is really getting down on their level. We have all kinds of developmental activities. We have age-appropriate toys, and we bring those things into the room, and actually once they go into the patient's room, they go home with them. We're a 10-bed pediatric unit. Every patient has a private room. The private room also has a bathroom. Every room has a bed that a parent can sleep on. We encourage them to stay, although it's not required. A big part of it is really connecting with their parents. and knowing that the parent knows their child better than anybody else. So we always defer to how the parent feels their kids are doing and really look to them to work with us in taking care of the children.
As a physician, we often have other concerns or other things that we want to address in terms of their illness, but I think really listening to the parents and listening to what they're worried about and really focusing in on that helps build that relationship and alleviates those concerns.
We just have a great history of really being a standing presence in the community for pediatric care.
I just wanted to share how thrilled I am, like, with how involved everybody in the Mary Washington community has become in our life. I think that's...
Yeah, and I'm very grateful for their help and their support and care.
I just feel like they've really become a part of, like, our family.
I think Mary Washington is leading the way in pediatric care. We are the front door to the community, and the bottom line is that being the front door to the community, we have an obligation to the community to serve the vast pediatric population. It is absolutely rewarding and highly satisfying to see both firsthand children come in either severe pain or having a seizure or some type of medical condition, and we can fix it.
Seeing that you've had a part in helping a patient go from really being very acutely ill to getting better and going home, it's very rewarding for the nursing staff to observe that and to know that they had a really important part in making that happen.